I'm going to quickly go over that because a lot of confusion started after the WHI study which came out in 2002. A lot of confusion started, but why that happened we're going to go over. But I want to make this clear for you. Women in their 30s or 20s, when their hormones, their natural hormones in the body are at their peak, do not have cancer, do not have heart problems, do not have insomnia usually, do not usually have all the symptoms that we have already mentioned. So it was the natural hormones causing breast cancer and a risk of heart disease and stroke. Women should be having those more in their 20s and 30s, not when they don't have the hormones. So that's a big question. Most of the time we are all told, no, you should not be taking hormones because it might cause all these problems, but it's rather opposite. Not having the hormones causes all these problems. Data suggests that it is hormone imbalance that contributes to breast cancer. We know that most breast cancers occur after menopause, precisely at the time when the ovaries are stopping to produce the hormones that they used to produce. So why more breast cancer after menopause? I'm going to quickly mention this, and it's very, very straightforward and very common sense. Progesterone, as I mentioned, starts to decline in 30s. Progesterone is protective to breast cells. It prevents the abnormal cell division in the breast. So it starts to go down in 30s. In next 10 years, estrogen is going down, and the good estrogen is going down, the estradiol and estriol, and the bad estrogen, E1, is going up as we are approaching towards menopause. So by the time a woman is menopausal, they have 80% reduction in the good estrogens and 80% increase in the bad type of estrogen, which is E1 or estrone. Need to check your estrone levels. And there are ways to decrease estrogen levels even if you don't want to do hormone replacement. E1 is undesirable and should be reduced. And in summaries, breast cancer 70% of the time is caused by too little natural progesterone, too little natural estriol, that is a type of estrogen, too much estrone, which is the bad estrogen, and low melatonin and all the other hormones which also have protective benefits are low after a certain age, and that all increases chances of having any cancer and also breast cancer. Mutations can occur due to toxins and detoxification not working properly in the body. So most of the women actually who have breast cancer do not have a family history already. It's all these 70% of the cases are due to all the things that I mentioned. 30% is due to genetic factors. Even when somebody has genetic factor, if you follow all the other things, that 70% of the time you can actually prevent breast cancer from happening even if you have a family history of breast cancer. So the WHI study, which showed that we should not be using hormones, that study actually used synthetic estrogen and synthetic progesterone. Synthetic means that body realizes that it's not its own and it's something foreign and it doesn't fit into the body like your own natural. So like natural estrogen has 400 functions in the body, synthetic estrogen doesn't have any of those, probably 1 or 2 out of those. It does help the bones. It does show in the study that bones did get better. So reanalysis of this study and many others since then has the following conclusions. When started early, hormones are protective on the heart and the brain. Progestin, which is the artificial hormone, also Prempro, Provera, medroxyprogesterone, etc., they are all artificial progesterones, have been shown to increase the clot formation in breast cancer in 5 different research trials compared with natural progesterone, which is associated with protection. Bioidentical estrogens should always be given by transdermal or skin route. They should be rubbed onto the skin or have a patch, not taken by mouth. So in the research study, the WHI study, they used estrone, which is the bad estrogen, which I actually already mentioned, and was given by oral route. So no wonder it will increase problems. So bioidentical hormone replacement therapy is safe. A lot of research studies have shown that, and is effective in preventing age-related decline and diseases. Estrogen should never be taken in a pill form though, when you're replacing natural hormone. Also, even if it's natural, should not be taken by mouth. So what is bioidentical? I keep telling you bioidentical. Bioidentical hormone has the same chemical structure as your own body hormone that you were producing when you did produce them in balance. So if you replace bioidentical hormones, they will give you all the benefits that you would have had when you were producing your own natural hormones. So who is this? Does anybody know her? You know, while we are talking about hormones, it's actually good to mention her name because a lot of Suzanne Somers. Yeah, so she actually is a breast cancer survivor. She's 62-year-old right now, and she seems to be looking younger every year. I attend these conferences from American Association of Anti-Aging Medicine, and she's usually over there, and she looks better every year. So she has been on all these treatments, natural treatments, and she has told in a lot of the conferences when she speaks that she seems to feel and look better than she looked at 19. So she has since then written 2 books to help you know, everybody read about it, because she's not a doctor, so she has written it in her own words so that, you know, it can be understood more easily. I would recommend that if you can, or if you want, you know, you can get those. They're available in every library. Any bookstores should have those. So going over to testosterone, very, very important for men and women both. This starts to decline in men and women and causes loss of desire for sex, joint and bone pain, muscle weakness, loss of confidence, moodiness, depression, anxiety, muscle loss, fat gain, etc. List can go on and on. Testosterone restoration not only addresses these symptoms, but studies have shown a protective role of testosterone against heart disease, cognitive decline, that means memory problems, and bone loss. A lot of research studies have shown that. Traditionally, testosterone was thought to be associated with heart problems and prostate cancer. That is completely not true, and I'll show you why. If this were the case though, women and men in 20s, actually men need much more testosterone obviously, but when men have their peak amount of hormones in their 20s, if testosterone was causing the problem, they should be having more heart attacks and heart problems and cancers, everything at that time instead of in their 50s. Prostate problems do not usually arise in 20s, so it's very clear if you have natural testosterone, it will protect your prostate and not cause actually the problem. In fact, New England Journal of Medicine, which is a peer-reviewed journal that all of us read, it's something. If something gets published over there, it's usually accepted by all doctors, because it's not easy to get an article into this kind of peer-reviewed journal. So in 2004, they published an article saying that it is low testosterone and high estrogen which causes prostate cancer. I had mentioned earlier too, men start to have lower testosterone and more estrogens as they age, and that's why it causes prostate problems and also causes atherosclerosis and heart problems and high blood pressure. Since then, a lot of cardiology peer-reviewed journals have published a lot of research studies on testosterone. They went on to say that lower testosterone levels can cause more risk of cardiac and neurological events. So if a man is low in testosterone, they are more at risk for depression, anxiety, etc. But the most important thing, the cardiac and the neurological events. And this has been reviewed in all of the cardiology literature in the last 4 or 5 years. I have seen numerous articles about this. If you are interested, you can email me. I can email you those articles. So let's move on to thyroid now. How many people do you think you have seen who have low thyroid symptoms? Low thyroid symptoms are very, very commonly seen. Thinning of hair, hoarse voice, dry skin, cold hands and feet. You do have that picture in your handout. Constipation, cold intolerance, puffy face, heavy periods, depression, anxiety, fatigue, brain fog, etc. List goes on and on. But what I want to emphasize here is that a lot of patients I see, they come in with normal thyroid tests, but they have all the symptoms that I have mentioned to you. TSH and free T4 that has been done is all normal. Doctor, my thyroid is normal, but I have all the symptoms that you just told me. So why is that? So very, very important. Thyroid, actually the T4 or the synthroid or levothyroxine that people get does not work at the receptor level. That needs to be converted to the active hormone, which is T3. The conversion can be affected. I'm sorry, I'm going rather quickly because we are almost running out of time, but the thyroid actually needs a lot of other factors to work. The T4 that comes out of the thyroid or your blood test, that is not what works. It has to be converted to T3. So if somebody is very stressed and has high stress hormone, which is cortisol, you will not convert your T4 or the thyroid hormone that you're making or taking from outside to the active hormone. So you will still have all the symptoms of low thyroid. If you have too many toxins, if you have had a lot of amalgams in your mouth, if you actually paint houses for your work, probably too many toxins is causing you to have thyroid symptoms, although your thyroid numbers done, the TSH and T4 are normal. Low iodine, zinc, ferritin, and selenium, those are the minerals needed at the tissue level for the thyroid to work at the tissue level. So if somebody is low in these minerals, you will still have all the symptoms of low thyroid, although your numbers might be just normal, because it does not work at the tissue level if you have those deficiencies. Thyroid hormone and function eventually decline in everyone due to both low thyroid production, and also the thyroid has to be able to work at receptor level. So as we age, the stress hormone goes up. Thyroid that you're making, the hormones that you're making does not work properly at the tissue level, so needs to be looked at. Need to get some blood tests done to look at your ferritin, zinc, selenium, iodine levels to make sure that thyroid can work at the tissue level. As you can see, thyroid can produce symptoms from head to toe and has to be in conjunction with replacement of other hormones, because all the hormones work together when somebody is already menopausal. Optimal thyroid function indicates or should have free T3 in optimal range, should have balanced adrenals, estrogen, progesterone, and testosterone. And already mentioned, these minerals should be replaced if you're low in this. Should not be replaced without checking. Overdosage and underdosage both can be harmful. Moving on to DHEA. DHEA is available over the counter, and I think that's very dangerous. But it does decline by age 50. We have only 1/4 DHEA amounts left compared to a 20-year-old. DHEA does enhance strength, does enhance sexual energy and immunity, but do not take without checking the levels. Excess can be harmful. Too little or too much can cause cancer, so you should get your levels checked. Moving on to melatonin, it actually declines, and by age 60, most of the people have zero levels, zero. You cannot do a blood test for melatonin, unfortunately, because it goes up at night. So either somebody has to draw blood at about midnight for you, or you can do a saliva test by yourself at night in your home. This hormone is known for its effect on sleep, as I mentioned, but it is very important and powerful anti-cancer hormone available to us because it activates natural killer cells. So no wonder after 60s we have more chances of cancer. Do not take without physician supervision because overdosaging can cause problem. Pregnenolone. This hormone is most well known for its effect on memory and concentration. Again, need to get your levels checked. Do not take without physician guidance. Growth hormone. I like to put that at the last because I've seen that most of the time if I can fix all the other hormones, sometimes growth hormone actually gets better by itself by exercising and fixing other hormones. A lot of the sites, if you Google anti-aging, a lot of the doctors are selling growth hormones online, but very unsafe to take unless you fix everything else in the body. Do not replace growth hormone. First, fix everything else, get on a good diet and exercise regimen, get all the other hormones balanced, but it is very important hormone in the body. It is very important to maintain the connective tissue, so maintains the joints healthy, bones healthy, and prevents frailty. So some tips for natural hormone replacement. It needs to be under the physician guidance. And even more important, this is another specialty in itself. Just like we have a cardiologist, we need them. We need our pulmonologist. We do need, all the specialties. So this is another specialty. It's new right now. A lot of people do not know about this. But you need to see a physician who is board certified and fellowship trained in anti-aging, regenerative, and functional medicine. And I use only the forms of hormones which are natural, which means they're bio-identical. Bio means our body, identical means same. So even the soy things that are available over the counter, sometimes it says it's hormone from soy, those are not bio-identical. Hormone replacement should always be accompanied by nutrients that activate the hormone receptors. Just like I mentioned, thyroid needs iodine, selenium, ferritin to be active. Just like that, estrogens need B vitamins. Insulin needs vanadium. I'm going to mention more about that. But also, you need to do detoxification so that the hormones can work properly. Also, some other therapies can be included in the anti-aging regimen, like homeopathy and acupuncture, which lets hormones work more optimally at the tissue level. So another thing, hormone function is more important than the hormone level. So that's why we need an experienced physician who does this all the time to be able to help you. So let's go on to the pillar number 6, the anti-aging supplementation. So all of us think that if we eat well and we actually eat a lot of fruits and vegetables, we should be fine, right? But actually it's not true anymore with all the good produce and beautiful looking produce that we get. A lot of pesticides, a lot of genetic alteration of the vegetables and fruits and the meats is done to have them look much better and look much bigger. But that is done at the cost of actually losing a lot of the nutrition. This is something which is becoming more and more because they're trying to save the money. So it's much easier to grow a produce which is using pesticides, because that way the insects won't infest the vegetables which are growing. So if you have to grow something without that, it's much harder. That's why organic vegetables are much more expensive, because it's harder to grow them. So organic vegetables are good to eat, but still with all the environmental pollution, the use of refined sugar and high fat and simple carbs and fast food, etc., the poor supplementation has led to so many diseases that by the time you are age 50 or above, you're not absorbing a lot of the nutrition that you are actually now starting to eat. Because of all the degeneration and degradation that happened with all the things that we did when we were younger. So diet alone is therefore not a tool we can rely on solely for our body to receive optimum nutrition. For this reason, supplementation is a cornerstone for, and it's one of the most important thing, along with everything else that I mentioned, for effective anti-aging program. There's no one magic bullet. Supplementation has to be done under physician guidance. There are blood tests available. We should not be doing actually blood tests. It's the functional test available to look at your vitamin levels. There's a lab in Colorado who does this test. Is covered on most of the insurances, including Medicare. They do functional levels of vitamins and antioxidants and omega-3 fatty acids to tell you, even if you're taking something, it might not be really functioning for you. It might not be really going into your cells. So you need to get the test done so that we can, don't have to guess anymore what you need. You just get what you need. So one very important thing, because Costco to GNC to Safeway to Trader Joe's, everywhere you see all the bottles of B complex, melatonin, to everything is there. So very important thing to look for when you're buying a vitamin for yourself. It has to be manufactured in an FDA licensed facility and has to be manufactured in accordance with GMP, or good manufacturing practice guidelines. So GMP certification should be mentioned on the bottle, and if you're not sure, there might be a phone number on the bottle. You can call and ask. But if somebody is GMP certified, they will mention it there, because a lot of people know about this already, and a lot of people do look for that sign. It should say not GMP, it should say GMP certified. And that means it's safe for you to take it. Otherwise, everything else that's available over the counter, there's nobody regulating it. Anybody can put anything they want in there. Most of the time it has been seen, let's say it says 1 milligram on it for whatever you're buying, and it has been seen probably there's nothing in there, or maybe it's like 0.2%. So it's really not very safe to take those things which are not GMP certified. Again, so the anti-aging program should be customized according to your age, sex, and rhythm, and according to your functional blood test for your vitamin levels. As I had mentioned, thyroid needs all these things to work, but there's another thing that I didn't mention, vitamin D. Actually, it has gone very popular in a lot of news, they're mentioning it. Thyroid does not work for you properly until your that vitamin D levels are 55 or above in the blood. That can be done by simply by a blood test by a regular lab here in Fremont. So if your levels of vitamin D is below 55, you might be taking your thyroid pill, or your thyroid levels might be normal, but you might still have the signs and symptoms of low thyroid. So need to fix your vitamin D level. Sunshine helps, and if the levels are too low, you do need to actually take the supplementation. Ferritin level needs to be greater than 90 for thyroid to work properly. Insulin needs chromium, vanadium, and magnesium and vitamin B3 to be active. Estrogens need B vitamins to be active. So moving on to supplementation, what else to look for? You should be looking for that the supplementation that you're taking should be without any fillers, without any binders, without any dyes and impurities. So another thing, do not take all your pills at the same time if you're taking 10 or 15 different vitamins, because your intestine will not be able to absorb everything. You do lose 70% of it if you take everything at the same time. So you need to divide that over the day. So take it a few times a day. Do not take B12 and vitamin Bs and coenzyme Q10 at bedtime, because you feel more energized, so you won't be able to sleep. Vitamin B12 deficiency, one of the most common deficiency above age 50, because as I had mentioned before, intrinsic factor is something that we do not produce because of the aging process. Low B12 does cause shrinking brain. I just saw an article last week in Journal of Neurology. They did a research on vitamin B12 causes brain to shrink. Low B12 affects the heart. Low B12 affects your nerves. It affects everything in the body, including your brain. So I had actually put together a memory enhancing nutrient program, which you can follow on your own if you like, but make sure that you get high grade GMP certified supplements. I'm going to quickly just go over this slide. The dosages are mentioned on there, and you can actually look through that and follow that. The vitamin B6, B12, folic acid, ginkgo. Important thing, ginkgo should not be taken if you're on a blood thinner. Then phosphatidylserine, very important. Vinpocetine should not also be taken if you're on a blood thinner. Resveratrol, very, very important, is in news nowadays a lot, and you can actually read more about it. Very, very important to replace. So I want to quickly, another maybe like 2 or 3 minutes, mention something. I told you I'm going to mention about healthy aging first, and then we'll go on to longevity. Now, longevity, actually, if you're aging healthy, you will have a better quality of life, and you might live longer. But there is a lot of research ongoing for telomeres. If you guys, that is something that's in the news a lot nowadays. So every time your cell divides, it actually loses part of a DNA called telomere. So we can assess how long you're going to live according to your telomere length. Shorter the telomere, shorter the lifespan, because every time your cell divides, you lose part of telomere, and when there is no telomere, your cell cannot divide anymore, and that's it. So this picture depicts how the DNA gets shorter and shorter every time, but what can we do? How can we prevent the shortening of our telomere lengths? Keep your homocysteine levels down. This is a test that can be done by any lab, and I'll tell you how to keep that down. But these are the actually four things you can do to keep your telomeres from getting shorter prematurely. Of course, follow all the anti-aging diet and all the 6 things that I mentioned in the anti-aging protocol. But keep your homocysteine levels down. Keep your oxidative stress and free radical damage low. Caloric restriction has been shown to help, and resveratrol. So homocysteine, as I said, can be checked from any lab. High homocysteine has been shown to cause increased risk for heart disease, Alzheimer's, Parkinson's, and impotence. It is no coincidence that homocysteine levels have been correlated with degenerative diseases of aging. So how can we keep it down? This is the protocol to keep the homocysteine level down. The lab range says 5 to 12 is okay. Optimal is less than 7 of homocysteine. So how can you keep it down? Vitamin B12, 500 microgram, folic acid, 800 microgram, B625. It's in your handout. I'm going through it quickly because we have run out of time. And also trimethylglycine, 500 milligram. Oxidative damage causes a lot of problem, and here is the protocol to avoid oxidative damage. Needless to say, need to eat healthy diet, organic foods, and take these things. It will prevent or decrease your oxidative damage.